I want to thank all of you for joining us today. We were talking before you all hopped on that we know there's a lot of vacations this time of year, but this is such a timely topic that is going to be valuable for your program. So I thank you for coming, and mention to your colleagues that this will be available on our website recorded. So with that, I guess I don't necessarily need to introduce our speakers, but welcome our colleagues who are speaking today. Sarah Sprinkle is the education coordinator in the cytology program. She received her bachelor's degree in biochemistry and molecular biology from Nebraska Wesleyan. And with her love of science, she came to UNMC for a post-baccalaureate certificate in cytology. From there, she moved to Cedar Rapids and worked at a local hospital as a cytologist or cytotech. And she joined the faculty in 2020. She also has a master's from UNMC College of Allied Health in Health Professions, Teaching and Technology. She will be getting a PhD this fall with a focus on interprofessional education. So we expect to hear a lot more about IPE from Professor Sprinkle. And Professor Koth, Jana, I'm sorry, did I say it right?
You did.
I forgot to double check. It's been a while. Jana Koth is the clinical education coordinator in the radiation therapy program in the medical imaging department. She received her Bachelor of Science in Radiation Science from UNMC in 1998, and she has a Master's of Public Health that she received in 2012. Her primary focus is educating students in the classroom, and she also has a lot of experience using the virtual environment radiation therapy system in education, lovingly called the VERT. She also uses the VERT in clinical settings, and I believe that she and her colleagues have investigated using the VERT to decrease anxiety in patient populations, specifically children, before radiation therapy. Her research interests also include student education and IPE activities. And with that, I will hand over the Zoom to Professor Sprinkle and Koth.
Thank you, Dr. Bielek, for that warm welcome. And Jana, Koth, and I are excited to share with you all our presentation here on interprofessional education. And you'll hear us reference now that as IPE, our virtual case study approach. We're excited to share this collaborative activity amongst cytotechnology, radiation therapy, and medical nutrition, and how it's evolved over the several years since we've been including this activity in our curriculum. And I have the pleasure of providing two different viewpoints of this activity, since I also participated as a student in 2016, and now get to share the perspective from faculty as well. We'd like to give a shout out to our co-investigators as well in these three departments. In cytology, Dr. Donnelly and Dr. Mukherjee. And in medical nutrition, Jana Ponce and Megan Timmerman. And in radiation therapy, also Lisa Bartenhagen. So in our presentation and conversation today, we hope to be able to share with you all the value and importance of obtaining knowledge and other professional programs, understanding the value in teaching how our professions can work together, and appreciating that IPE activities can be successful when completing online. And so through this process, we hope to kind of inform of what we've been doing, provide some interaction and conversation amongst our group here, and be able to influence and share in future directions how we all might continue this work in IPE. So IPE to me is an interactive educational experience, including more than one profession in which faculty and students both partake. So there's literature out there that discusses benefits and challenges of doing IPE in our curriculum. You know, students can benefit and faculty from appreciation of other professions. We can share an expertise. We can collaborate on a shared experience. It promotes providing a safe environment to practice in, and it allows for working on communication. So some challenges maybe others have experienced and that we have overcome ourselves is limited research in this arena, especially for the College of Allied Health Professions, faculty resources, and getting an activity of this nature developed and implemented, And so this all takes time. And as we know, time is valuable as a faculty member. And then working with programs that we're trying to do IP activities with, as each of our student schedules differ. So trying to find a time that would work for all parties if we're trying to do a synchronous activity. And so having experienced this activity myself as a student and then working in the clinical space for a couple of years, I can see how this transformed some and influenced some situations that I partook in, and also completing the UNMC-wide IP events as well. So as a cytotechnologist, we work with a range of professions, including interventional radiologists, interventional technologists, CT technologists, nurses, doctors, respiratory therapists. And so being able to appreciate those roles and then be able to educate and share the roles that cytotechnologists might do partake in on a daily basis. Often we have limited interactions with other professions and they don't see the other side, the day-to-day work that we're also completing away when we're not in their presence. It allowed me to be more observant and notice others around me and the work that they're doing, and to think critically about efficiencies that we could have, specifically in the hospital setting, working with all of these professions. So all of those benefits benefit patient care as well. And some references for those topics. So UNMC has an IP website that you can go to at this link that has some resources as far as the 2 activities they provide on an annual basis at college-wide. And they have an annual report that's listed there, as well as some IPEC a document to look at. And so the annual report, I went in there for the 2020-2021, just specifically looking at the College of Allied Health Professions. And there were 16 education projects listed there from our college, 2 outreach projects, 5 presentations, 1 publication, and 3 grants. So surprisingly and happily, there's lots of IP work going on amongst our college. And this gave me just an appreciation for all the work that others are doing and wanting to know more about what others are doing and how we can share that with each other. So some IPEC values or competencies that are broadly listed and available in a document on that website is broken down into 4 competencies that we'd like to bring to your attention as we talk about our activity and seeing how our activity meets these values, and maybe an activity that you complete meet these values. So competency 1 has to do with the values and ethics and being able to work with others in a respectful environment. Competency 2 deals with roles and responsibilities, being able to know one's own role and the role of others for patient care. The value of communication, being able to communicate with patients, their families, and the professions that we work with on a daily basis for patient care. And then team and teamwork, building effective relationships to continue to delivering excellent patient care. So now I'd like to pass it over to Jana Koth so she can share with us all about the activity that has been developed amongst cytology, radiation therapy, and medical nutrition and how it has evolved.
Thank you, Sarah. So we initially started the activity back in 2015. I had to do some digging to see how far back we went. After initially at that time, the radiation therapy faculty had discussions with cytology faculty. And I think that was probably after IPE started becoming a hot topic on campus. The first year we did it, it was really just a trial. We didn't really have any expectations of how it would go. We really just wanted to start with simple data collection to see how it would benefit students. The medical nutrition faculty had some conversations with us and decided to observe our activity in 2017. And then their students participated in 2018 and have been with us since. So in 2019, we basically did the same thing we did in 2018. And then in 2020, with everything changing with the pandemic, we decided to do just an online Q&A with all the students instead of having a formal presentation. So this allowed for student engagement while having limited contact with faculty and classmates, which they still felt it was beneficial. And then in 2021, we thought we should probably discuss cases again But with ongoing in-person restrictions, we decided to conduct the IPE event virtually. And the data was collected, which Sarah will discuss later in our presentation. Then this year, the students were really excited to get together in person. So we did that in April of this year. You can see, looking at our timeline here, that the cases did change a bit from year to year. We had to adjust the number of cases according to the number of students because they were presenting in small groups. And we also had to choose topics that were relevant to all the professions. Next slide, please. So the process, we just really started with this method. It seemed to work over the years. So we just continued that way. The faculty identified cases that would be applicable to all programs in which the patient could have encountered all three allied health professionals in some way. And then the students were provided the cases to gather the information. Then the same cases were used to provide an accurate history and associated cytology. The students worked in small groups to prepare the presentations with either PowerPoint, virtual slideshows, or both. And then for the radiation therapy program, only the post-baccalaureate students were required to present. It was an assignment for one of their courses. However, all students were required to attend and ask questions about other programs. Next slide, please.
So for the cytology piece of this activity, cytotechnology students were requested if anyone would volunteer to contribute as the presenters for this activity. So we needed a person to present on the profession. Someone kind of took over demonstrating MScope, our virtual microscopy education tool, and then someone took over explaining the case that we were conducting using MScope. And so, as Jana mentioned, similarly, we provided students the case and some initial guidance and gave them some deadlines for having these materials put together. And then we offered up with faculty time to practice with the students via Zoom before we would partake in this activity. And then we would present on the IP event day, and then students who were not presenting were still required to speak in some fashion, whether asking a question or answering a question from students of another profession. So here we have some pictures of an event in the past, and we can see a cytotechnology student delivering part of their presentation in MScope up in the background with a cell case in the back. And here we have some more just probably explaining these are squamous cells. We could be explaining not just the case, but all of the things that cytology profession might partake in. And this picture is just demonstrating that unique to our program is that we have several distance sites. And so our students can join via Zoom, and did in 2021 when we partook in this online activity. And so now I'm gonna toggle back and forth here, but pull open a virtual scope session that actually Dr. Donnelly recorded on squamous cell carcinoma. And so the case that we've used in the past several years has been a squamous cell carcinoma of the neck and tongue throat region. And so this just kind of demonstrates what the students would have shared in a 2-minute snippet during the presentation. So bear with me while I toggle to that video here. Can I get a thumbs up? Do we see the video, Jana? Okay. And I will say too, this video is a little soft with volume.
Keratinizing squamous cell carcinoma on a respiratory tract specimen. It has been stained with Pap-Nicolau stain. Squamous cell carcinoma is strongly associated with smoking. About 90% of cases occur in cigarette smokers. These lesions are usually found centrally in the large bronchi. In squamous cell carcinoma, the nuclei are irregular and angular. You can see the irregularities around this border, and how here we have kind of a nice point where it should be nice and round if it were normal. The chromatin is coarse to pyknotic, almost black, kind of condensed. And nucleoli may be present, but we often can't see it because of the dense chromatin pattern. we'll take a closer look at this cell and its chromatin pattern. And you can see here where there's some cleared out spaces and some clumping. So we call this clumping and clearing. One of the most striking characteristics of squamous cell carcinoma is its pleomorphism. And you can see that demonstrated here by this bizarre cell shape. Really large if we compare it to other cells in the background. Keratinization can be seen as dense or refractile cytoplasm. Sometimes it can be considered kind of waxy or glassy, as we see here. If you look at the background, you can see some anucleated squamous cells, which can be associated with squamous cell carcinoma. And you can also see that there are some bizarre or different sizes and shapes to the cells seen around in the background. The background is often necrotic and has some granular debris.
Awesome. Just going to
Keratin-
pause it, but pull this back up again and explain that in MScope, we have the capabilities of having side-by-side pictures as well, and even a quadruple picture to be able to show and explain benign versus malignant features. So the students would have utilized that feature as well as being able to show that we can go up and down in magnification on this virtual tool, and that we can have annotations that students are previously have already within a case, and then students are also able to annotate and give diagnosis themselves on MScope as well. Come back to our presentation here. And so also the students would have explained that to get to this point, that a cytotechnologist is present on the procedure that would have collected the sample. It's called a fine needle aspiration procedure, an FNA. And so students, cytotechnologists bring their stains and the microscope to the patient bedside and assist the clinician in dictating what's happening during the procedure. So cytotechnologists give an adequacy statement indicating if enough cellular material is there on the slides to give a definitive diagnosis down in the lab. And so once that procedure is completed, it would go back down for completion of processing, in which cytotechs assist in that and provide an initial diagnosis. And then all non-GYN specimens, so all specimens that are not pap smears, would go to a pathologist for final diagnosis. And so then would enter the radiation therapy programs part. So after a diagnosis comes the next step, which would be treatment.
Thank you, Sarah. So the next phase, we would leave the virtual microscopy suite and we would go to our radiation therapy virtual room. And then our students have always started out by giving a brief overview of the treatment process. They included how a radiation therapy prescription is written by the radiation oncologist and really what that radiation dose means. And then they discussed how the dosimetry plan is created to best irradiate the tumor while avoiding healthy tissues around it. They also described their role as a radiation therapist, including the daily contact with the patient and how to assess for side effects. And the VERT system shows cross-sectional anatomy, tumor and treatment volumes, and how the radiation dose is distributed. Next slide, please. The images shown here show a lung case in the VERT room. The students were able to show the tumor location in the transverse CT image, the one on the left. And then they could show how the patient is positioned for treatment every day with the lasers, and that's the image on the upper right. And then they described how the linear accelerator works, which is shown on the bottom right. This allowed for students from the other programs to see a treatment room without actually going to the clinical department. And disclaimer, these are not actual images from our case. These are from a case that actually came with our virtual system. Next slide, please. So we can play this video. So this is a silent video, so you won't have any sound on this one, of a radiation beam animation in which students explained that the patient what the patient experiences during treatment. And then at that time, kind of while this was going on, the students had discussion about patient immobilization, including radiation safety concepts and how our rooms are appropriately shielded. And the students were able to appreciate what patients hear during the treatment because this does have a simulated noise during the animation. So kind of during this time, the students always had a really good discussion about what was going on, and the other students seemed to be very interested in what the patient was actually going through. So when this finishes, we can go to the next slide. And this is also more beneficial than it would be for the other students to go to the clinical department because we can't show radiation beams in the department. They wouldn't see anything. So this actually helps to show where the radiation is actually passing through. These are always longer during a presentation, aren't they? So then similarly, this is not our case, but it's one similar. This allows the students to discuss cross-sectional anatomy and the importance of limiting the treatment to the pathology while avoiding healthy tissue. They also described how linear accelerator takes a limited CT scan before treatment to ensure that the patient is correctly positioned. Next slide, please. When this is over. And again, this is helpful for students who aren't normally used to seeing cross-sectional anatomy. I think it allows them to understand what we're actually looking at. And then these images here are showing the critical structures for a treatment. So the students were able to describe why radiation therapy must be so precise and how side effects can occur based on the tissues that are in the radiated area. So this sparked a lot of questions, I think, between all the students because cytology students were just interested in the whole process. Medical nutrition were interested in how the side effects were related to the treatment itself. And then our students kind of could integrate between the two. So then after the radiation therapy students presented, then the medical nutrition students gave an overview about their role in caring for the oncology patient. They explained malnutrition, including the characteristics to watch for, which I think most students were really interested in that because it's something that they had heard about, but maybe they didn't know the characteristics. And then they also conducted nutrition-focused physical exams on each other, which was really beneficial. Next slide, please. The medical nutrition students also included these images in their presentation. They wanted to show the importance of watching for signs of malnutrition. So during the physical exams, they explained that decreased subcutaneous fat is noticeable in the orbital fat pads, the buccal fat, the triceps, and the ribs. And they also talked about how areas of decreased muscle mass are shown in the temples, clavicles, shoulder and scapula, interosseous, quadriceps thigh, and the calf. And so the students, I think, really felt that was beneficial because in looking at their oncology patients, especially radiation therapy patients, they could see some of these conditions going on with each patient. Next slide, please. These images from another year that we did this just show the medical nutrition students presenting as everyone else actively listened. Next slide, please. And then after the activity, we have been doing some small group work in the last couple of years. We felt like it was helpful for the students to just talk with one another after we were finished. And they could ask questions of each program and maybe feeling more comfortable in a small group setting. And we didn't have any formal assignment for that part. We just let them talk amongst themselves. And then next, Sarah will discuss our most recent research study from the online IPE event that we did in 2021.
Yes, thanks, Jana, for that background. And so in 2021, the pandemic was still occurring, and as the university recommended that fewer in-person interactions be conducted. And similarly, they provided an IP activity amongst the entire college online. And so our three professions felt that continuing this activity, if we could online, would be beneficial and worthwhile to our students. And so the manuscript that was initially published was Cytotechnology and Radiation Therapy in 2017 that indicated positive student outcomes from knowledge learned amongst the professions and their perception on positivity of completing the activity helped persuade us into making this move too. And so new research was then conducted with this event being entirely online and the inclusion of medical nutrition in our group. So this was an IRB approved study, including in that year, 17 cytotechnology students, 8 medical nutrition students, and 6 radiation therapy students. So all students partook in the activity, but they had to voluntarily commit to taking the survey if they chose. And so a pre and post survey was conducted with a Likert scale to assess knowledge of each student in the other professions, the methodologies used in education, and their perception of the online nature of the activity. So this activity lasted roughly 2 hours online, in which again, each program designated students to present about their profession and the education modalities and the case that was offered that year. And so this allowed all of the students to visualize a patient's journey through diagnosis, treatment, and follow-up care. So again, as we kind of just described, the methodologies that we were able to showcase on Zoom, excitingly, included the virtual microscopy with cytotechnology, the virtual environment radiotherapy training system, the VERT, with radiation therapy, and medical nutrition was still able to provide video, pictures, and show their nutrition-focused physical exam. So here we have the survey results from the perception of the profession. And so we have the cytotechnology grouped, the medical nutrition, and radiation therapy. So for table 1 there, the cytotechnology profession, the radiation therapy and medical nutritions would have completed the surveys for the cytotechnology addressing their perception. And likewise for the other two. So the questions we asked was, do you know about the profession? Do you know the role of this profession in the case that we discussed? Do you know the role of this profession in patient care? Do you know what the education modality they use is? Do you know how that's used in their education? And would the IP activity help you in understanding that education tool? And would the activity help you understand how the profession is involved in patient care? And so in descriptive analysis was done with these results. And so just by visualization, we can see from pre and post survey that we had shift to more agreement for all 3 of the professions involved. And so again, when just looking at numbers, we have to keep in mind that there was more cytotechnology students. So that's why a more higher number might be in one of the other tables. So then specifically, we looked at some of the questions addressing the online nature of the activity. So the online interprofessional activity will help me better understand how the role of the cytotechnologists, radiation therapists, and medical nutritionists fit into the healthcare team in providing patient care. So looking at these, we asked this of the cytotechnologists, medical nutrition, and radiation therapy students. The pre-survey is indicated in the red, and the gold yellow is the post-survey. So we can see that the cytotechnologists increased their strength of agreement from pre to post, with medical nutrition having a slight increase and radiation therapy moving more to a neutral standpoint as far as this agreement. As far as the online activity allowing for visualization of these mentioned educational tools, we have the cytotechnology students, medical nutrition students, and radiation therapy students outlined in the table here in gray, red, and gold. And so the cytotechnology students had increase in the strength of agreement for this as well, whereas medical nutrition stayed about the same, as well as radiation therapy, but they were in agreement with this, descriptively agreement with this question. The question of, I would prefer an online interprofessional activity over an in-person and professional activity. The cytotechnology students had a generalized increase in their strength. Medical nutrition had kind of a mixed, roughly 2 students increasing and 1 student decreasing. And then radiation therapy went to about more neutral standpoint for this as well. So what we can kind of start having conversations about is that the tables and tables 1 through 3 show that the IP activity did increase knowledge for students in these other professions, as well as the educational tools provided in their training programs. Figures 1 through 2 indicated that the online nature of the activity was sufficient in meeting the objectives, with students fairly in agreement to those statements. And figure 3 indicates that there was a mixed programmatic perception about continuing the online nature of the activity. And this could be due to Zoom fatigue that was brought on by the pandemic. And the cytotechnology students are more versed in the online nature of learning due to how the program is set up with already having distance students. So the success of the activity illuminates the possibility of doing further online IP activities amongst our 3 professions. And similar to a previous study, by conducting it online, it eliminated logistical burdens for planning for space and time and moving across campus to each of these locations. And with the virtual technologies available, it was possible to anytime, anywhere share this activity as we had in the past, and with students all across the country. And in future, we like to continue this good work of providing IP activities to our students and enhancing their experiences. Some references there. So this information was shared at a poster presentation in July of 2021 at the 3rd annual Heartland Interprofessional Education Conference. And so just in synopsis there of that data was that the online activity was developed for our 3 professions due to the pandemic. And again, similarly to before, the 3 professions went through diagnosis, treatment, and care of a common patient case. And the activity provided students ability to expand their knowledge of other professions and their education, and that it was successfully completed online. And so with that, we'll jump back to Jana, and she can explain how the activity looked this year.
Thanks, Sarah. So this year we just let the students, we had them do kind of a reflection in Canvas. So we just asked everyone in all the programs to answer the questions after the IPE event. We asked them to describe what they learned from this activity about the profession, what they learned, or what did they, so what they learned about each profession, and then what they would, how they would incorporate what they learned into their practice. Next slide, please. And then these are just some responses from, I picked some of the shorter responses from radiation therapy students. So the first one basically says, from the presentation, I learned how many different types of strains there are to look for different identification markers of a cell. I also did not know that they are present during some procedures to give real-time feedback about the histology and pathology of the cell. And it was interesting to find out how involved they are in everyday care of patients. The next student talked about the medical nutrition profession and about how they found it interesting that protein was the main nutrient they focused on, besides just overall an increase in calories. They also found it interesting that there were so many factors that go into diagnosing a patient that is underweight or have muscle loss. And then another student kind of had a take on both of the professions, stating that the student understood why some tissue samples take longer to process than others, which might delay a definitive diagnosis. And then the student stated that she could be more aware that when she's helping patients onto the table, if noticing muscle wasting or pitting edema after handling. But those were some really good responses.
Yeah, and I'd like to add too that the activity included our distance education students for cytotechnology, which hadn't always been the case in the past.
Then here's a student testimony from one of the radiation therapy students this year.
Hi, my name is Julie. I'm a radiation therapy student and I participated in the Interprofessional Education Program activity in the spring of 2022. I found this activity beneficial to my learning and applicable to my future career in radiation therapy. When we think about a job or a department that's different from our own, we may oversimplify the duties and skills required. Before this activity, I thought cytotechnologists only worked in the lab and used a single staining process on a tissue sample. And I thought medical nutritionists just advised patients on what to eat and what not to eat. Likewise, people may oversimplify radiation therapists as button pushers. The IPE activity broadened my understanding of these professions and how interconnected they are with my profession in the oncology department. I learned that cytotechnologists may be involved in the biopsy procedures, and they use several types of stains on the same sample to determine various characteristics. And some of these stains may have a longer processing time than others. From medical nutrition, I learned that malnutrition is not obvious. They use hands-on palpation methods to evaluate a patient's muscle tone and possible fluid retention. Using this new information, I can understand why a patient's definitive diagnosis may be delayed due to a staining process. And I can be more aware of possible muscle wasting or pitting edema in my patients as I help them on and off the treatment couch. As a current student, the IPE activity reminded me of the larger system at work within oncology and how we all work together as a team to help care for oncology patients.
That concludes like our formal presentation piece, and we were hoping to have time to open up for more of a conversation and be able to learn together and have anybody else share with us activities that they're completing in their programs or how they're incorporating IPE as far as assignments or grades and things in their programs, or yeah, any type of conversation we're welcome to have. And I can drop those questions in the chat too, but anybody's welcome to spark conversation in any way.
That was an excellent presentation. I'm very anxious to see if others have similar experiences they want to share.
Sarah and Jana, this is Corey, and thank you so much for this presentation. This was just an outstanding presentation, and you represented all of our professions so well. A total aside for everybody on this call that Jana's not on this call. She had a beautiful, healthy baby girl on Saturday. Mia Deborah arrived on Saturday, so she is very busy with her 4-day-old baby today. So good thoughts to her for sure. But one comment that I got often after we very first started working with cytology and radiation therapy on this was like when I would tell people about it, just kind of like raised eyebrows, and people would have to think about, what do those three professions have in common that they could possibly be working together on? And I think this just showcases the opportunities for, people tend to maybe think, oh, PT and OT, sure, there's an interprofessional education thing that could happen there, but medical nutrition, cytology, radiation together at last, how does that even work? So it really does show how interconnected with so many different professions patient care actually is, and how we can take advantage of opportunities like this to highlight those, and everyone learns from it. I know I learned a ton being a faculty member being involved in this. So just fantastic work to you guys. Fantastic job keeping it going and making it better and better all the time.
Thank you, Dr. Hansen. And I know from that report that I brought up earlier that there's other people who do similar activities. So if you're on here and you do an activity, we'd love to hear about it and just maybe a brief synopsis of what you guys are doing.
Or maybe there's another program that wants to join us.
Yeah.
We could add another program.
Sarah and Jana, I will share what as OT, can you hear me okay?
Mhm.
Okay. What we did in our first cohort of OT. So we do what's called, well, our OSCEs, our clinical examinations structured. We had the nursing students do a mock OSCE with us, where the nursing students were our patients, and the OTs were really getting to practice what they would be doing with the standardized patient in a week. So this decreased our OT students' stress levels for these high stakes examination, while also giving that very personal experience to the nursing students. And so it was nice because the nursing students were involved in at least one case and observed 2 cases with an observation form. And then we would discuss, okay, now nursing students, what would be your role with this client with this condition? And we just got to hear a little bit of the nursing's role. It is really more focused on helping the nursing students understand what OT could provide in these multiple settings with these multiple conditions. And it was very well received and excited for future events.
That's awesome. Thank you for sharing. I think I've heard from others, and similarly for cytotechnology, that we all want a piece of respiratory therapy when they join. So there's lots of people that want to start a IPE activity with them. So
Lori Bolte just posted a comment that I want to make sure everyone reads. It's very interesting. And sometimes when we think about interprofessional or teams, we forget the patient and their caregivers part of our team too. And the value of your IPE to improving patient care and their understanding is invaluable. Lori, thank you for sharing that in the chat.
Jana and Sarah, I think it would be interesting from the radiography standpoint to potentially do an IPE study in which you follow a patient who was diagnosed with throat cancer or tonsil cancer, thyroid cancer, received radiation treatments, and the respective tissue damage, the resultant issues with swallowing, and then they undergo texture swallows to diagnose that. I think it's all very interesting how we see the cellular changes at that level. And sometimes in our teachings, we don't always get deep down into that. So that could be very helpful in understanding the importance of those swallow studies and the integration that really all comes into play with that.
That's a good point. And that would have to do, I think, with kind of after treatment. And Laura's done a lot of work with that, with survivorship and late effects, some what people deal with long term.
Yeah, I think that could really open up a lot of understanding to the patient's experience from our mid-level experience with that, and maybe a further follow through post-treatment for your students as well. And I don't know at what point cytology probably doesn't, I would assume not sampling tissues after post-treatment levels. Correct me if I'm wrong there, but you could provide a sampling as to why the treatment occurred, of course, and then we could follow that whole process.
sure, we would see radiation type effects in samples from if a biopsy was taken again due to maybe a nodule coming up again on a CT scan. So sometimes that nodule, could be reoccurrent cancer or just effects of radiation.
This is terrific, just an absolutely terrific learning experiences. I do have a few points, actually. One being, I know Corey was saying earlier that OTPT are kind of a natural link, that's an obvious link to some interprofessional things. But even for your case, I'll speak for physical therapy. You know, we see patients who are in the midst of radiation therapy or immediately after, and have to deal with that muscle wasting and fluid retention and things of that nature as we look at trying to strengthen aerobic endurance and trying to reestablish some of those things. And I can see a continuation case of this, you know, where we bring other professions in. They need to be in the beginning so they have an understanding of each of the elements that the professions bring. But I could see where we could continue the case along the continuum of care as well. And so just all sorts of ideas. I had a couple of thoughts though, one being, this is such a powerful learning experience, and yet you're focusing on knowledge. You mentioned the IPEC core competencies, but do you have those as a learning objective within one of them? No learning experience has to address all four, and nor should they really. But do you have those in the behavioral objectives, and then so that's a clear focus of team that's to be learned from that experience?
We don't have them written in.
Okay.
At this
That's
time.
That's an easy thing to do. And I bring it up because then you can assess the knowledge piece, but then you can link it to an assessment of team. And so one that comes to mind is the Interprofessional Collaborative Competency Attainment Scale. Then you can use that as a standardized measure that gets at some of the competencies you're trying to develop. So then that's an easy addition. That is, especially if you have an IRB and you're studying it, you can look at changes pre-post. That's a validated scale. So just a thought there. And then the other thing that strikes me is the literature does bear out where the debriefing is such a powerful component, because you can typically capture kind of that emotional piece for learning to occur when it's kind of immediate post. And so where you have kind of an informal discussion, if that could be formalized in a way with facilitators where you can listen to the students' reactions, but then also hit home what some of those key team pieces are. Those aren't always as understood by students at the time. They almost have to be kind of connect the dots by facilitators. And that would be, you've already have the session in there where they're informally interacting, and you could refine it in that way. And just two observations, because this is just a terrific learning experience. So.
Thank you. We'll have to take that into consideration when we go forward and how we can improve on things.
Yeah, because you're getting at roles and responsibilities. One of the important key pieces in that values and ethics domain is not so much the ethics piece as the values. That one of the things that the literature says is the students have to be in a position to have a frame of reference to value the other professions. And so you can measure that as well. But I like the ICAS with the team, because all the elements in your learning experience support that scale and the questions on it. So, and I'll just put a plug in, because as you know, Dean Meyer is really trying to kind of help ask us to formalize some of the interprofessional education initiatives in the college. And so you've heard Karen Honeycutt and me talk a little bit about it. We have that report that you cited, Sarah, earlier. And then we have the survey that we asked the faculty to fill out. And so here this fall, early fall, we'll come back to the IPE committee and lay that out for the faculty writ large, and then do just what you're doing here. Try to stimulate these conversations and best practices, and bring together existing learning experiences and see how we can help support moving those forward, or developing other ones that we all feel need to be developed. So just want to put a plug in that you are kicking this off in a perfect way. So thank you.
I want to add to what Teresa said, or maybe phrase it in a little bit different way. I'm hearing that the survey can inform the committee, and the IPE committee can support forward momentum to advance existing IPE activities and creation of new. But these things in your presentation today shows how the education overlaps completely with scholarship. And so I'm really open as we're thinking about our strategic initiative and new activities. The old expert think tank model might be something we could bring up. So if you're planning an IPE and you bring it to a group, they could offer suggestions about how you might set up your assessments, but then also just share tools and experiences about things. So if there's any way that our office can help facilitate that, just seems like it's a win-win besides sharing your information, helping other people build their own projects.
Yes.
Because ultimately, I'm sorry, I was gonna say ultimately it's good educational research. So,
Absolutely.
but sorry, Sarah.
No, I was just going to say that this is something as a newer faculty member that I'm still learning how to identify when something in education can be also a research initiative as well. And so bridging those things together. So, yes.
Yeah, until this point, we really haven't, there's been so much good interprofessional work done in the college and across colleges to a certain extent, but we haven't had an infrastructure that really can kind of help kind of bring people together. And that's what we're hoping to develop better, so.
Maybe your committee could even think about whether we need parallel seminar series now. Maybe there needs to be groups reporting out on their IPE, and occasionally it'll have research and data, and sometimes it'll just be lessons learned. But this is again where everything we do is overlapping circles, and want to make sure that we provide an opportunity for everyone to share their good work and support each other.
Another conversation too is how each of our programs implement IPE within our curriculum, as far as, is it volunteer for the students to participate, or do we give grades in some sort? And so that affects participation from all levels in different programs.
That was one of my questions to you, is like, and maybe it's, you don't have to answer it, but for people to think about, but is there a way now, like you said you had volunteers, and for the research piece, you probably will, to use the data, but is there a way to institutionalize this at least one of the programs now so that it becomes part of a course or a required learning activity? Because that's the next place you'd look then to say, okay, how do we start formalizing this in that way? And others can still kind of participate as their program allows, but can we start linking it to certain programs or whatever to get a foothold,
This has been a great conversation. Thank you for your presentation. And also, I really appreciate that you left time to bring engagement for us to get a broader perspective of IPE in the college. I'm looking at the time and it's 7 minutes till the hour, and I know others may need to take a little break before their 1 o'clock meeting. Is there any last question before we all wave to each other? Well, then, thank you again very much, Sarah and Jana.